Hi, it's Carol. Um, Getting to you today about this chronic pain stuff that I have had the privilege of experiencing. Okay, so I know most people will not say that pain is a privilege, but for me it is because I couldn't understand the population that I feel I am also called to work with unless I felt unending, okay, I call it 12 because, I'm a dramatic person, but let's just say it's a 10 level. And I couldn't have understood it. I have dealt with chronic pain all my life, but I've always had breaks in between. So it's not like I haven't had those issues. In fact, my body was made very strangely. I have arteries where people don't have arteries. My uterus was weird. Just like stuff with me has always been like, I wonder, when I was put together, what the heck happened? But for whatever reason, I've always been different. I would have to tell the doctors, you're doing surgery, please check for arteries that aren't where anybody else has them, because I've almost bled out because apparently I'm put together differently. Well, we all know I'm put together this way differently. My friend Steph, who I'm going to talk about today, and I better get her tagged in this the video. She understands my brain, and she can actually translate for me, which is really interesting because I'm titrating off all of my medications right now through doctor's advice and consulting. And I hope to be off everything by the time I finish healing. And I sent her a message last night, made no sense. Because like I woke up in the middle of the night, I got about 2 hours of work done, then I went back to sleep for another 5 hours. And I sent her a message and I'm like, I don't know what that means. And she translated it. She actually translated it. So that was funny. Anyway, talking about chronic pain. Now I'm looking at a post. Currently I have a computer here, and a phone there. That's how much work I'm doing right now. It's not overworking. It's just making sure that I'm prepared when I'm talking to you guys. Okay. Hey, Jackie. Love you. Okay. So I have been learning about chronic pain and the mind-body connection. Now, everybody talks about that. Those are buzzwords. I've heard it forever. I've certainly heard it outside of Western medicine as much as, in other countries where they seem to, in my personal opinion, understand in a lot of other countries that connection and how it's not as simple as, we've got cancer, let's just cut it off, and not realizing that there are predicated reasons why you had the cancer. And if you don't get to that, will it come back? Well, it can. I mean, statistically speaking, that first 5 years, they're checking you, trying to make sure that you don't get the cancer back here or there. So as I'm looking at this, I've been through about 10 months of pain. Yesterday, I was out all day, which was a big one. So I knew I had to prepare for that, and I did. And I did not come home in any excruciating pain. Now, I do have an adrenaline-free zone here. And I think that's a must for anybody going through pain. How many times have you been told that stress makes it worse, or this could be stress related? So I'm asking you the question, if you were born and had a family situation that was traumatic in nature, but you might not identify it as that. You may not say it was abusive. You might have said it was a little bit of chaos, or like parents like to stir the pot, or however you say it, it elevates your response to the adrenaline. Your adrenaline response elevates. And at some point, I believe we live under an illusion that pain is almost going to protect us. And I don't believe that's true. And so I have been treating myself with chronic pain through relaxation techniques, making sure my muscles are relaxed, being calm, working through all, looking in my environment. Is there anything that is causing an adrenaline response? So knowing that I have more control over my pain than I realize. I'm not saying that there's not medical problems, that, you know, I was hit by a car, things like that. But the thing is, I believe we hold it in if we have experienced trauma and abuse. Now, I don't want to get anybody mad about this, but I think fibromyalgia is from trauma. And I know they've done studies. They say, I've never met somebody who has fibromyalgia that didn't experience past trauma. If I can do an assessment about their life, their family systems, I can find that they actually did experience trauma. So what if our bodies are having a response to that, and somehow we continue that because we are living under the illusion that that's actually working for us? So if we're living under an illusion, isn't there a possibility we could shift from that if we choose? I mean, we don't have to choose, because it's possible that we're scared to let go of that illusion, because then what happens? So as a bariatric patient, part of my illusion was, I'm going to keep all this weight on so nobody can rape or molest me again. I can't be hurt by a man again. So I kept all that weight on, and then finally I shed it. And that was almost, well, it's 8.5 years ago. And when I shed it, I had to face the whys that I ate so that I would have success long term, which I have. However, you know, we all know I've gone through medical stuff, like all kinds of medical stuff that have also, Robin, I've got to talk to you today. So we all know that I had medical problems that also attributed to my success as a bariatric patient. And also I did learn the whys. And that's what I'm here to do, is help you to understand the whys of the chronic pain, the whys of the things that you use to mask. Because if unmasking therapy is taking off those masks, it could be chronic pain, it could be addiction, it could be, I'm sorry, Robin, I have to stop everything because you're here and I love you. It could be gambling, food, you know, all of those kinds of addictive things that we do in order to mask our feelings. But if we unmask our feelings, then we really can connect. And if healing's through connection, then wouldn't we want to do that? And intimacy in relationships is connection. So any relationship I have, connection is so important to me. And I want you to know, I called the doctor that, one of the doctors at Kaiser that I felt I had some unforgiveness with. Actually, Kaiser, like the system Kaiser. So I decided to go one at a time and actually talk to the doctors that had labeled me alcoholic addict, and connect them human to human. Oh my gosh, how powerful. So powerful. So powerful for me to let go. So powerful for me to tell them that it really must be difficult for them to watch their patients suffering with chronic pain that actually aren't addicts. Maybe they're addicted to the opiate at the moment, but there's a difference between that and a true addict. And, you know, you can all fight me about that. But there's a difference. If you need that medication because you have profound medical problems, that is not the same as, I'm a narcissistic, you know, really cleared, I drink and use in order not to feel, instead of ordering not to feel pain. So you guys all know that I'm working on alternative methods. My friend Robin is helping me with that. My friend Steph is helping me with that. She's very well versed in this, and I'm going to put her on there as well. Because right now, and I actually would like to show you guys what Steph does, because Steph is just amazing, and I am so supportive of her that I really feel like I want to help take her with me with whatever success that I have. She does the Alpal Truth, and you know what this is? It's for abused people. Now I've asked her to consider, because originally these are for children, but you know what? Through abuse, we gain lies about what's true and not true. So these cards are amazing. However, I want her to rebrand for adults too, because I honestly think we can help more adults than children. And you don't need a therapist for this. You know, I'm going to go teach a pastor to do this, and he's going to translate this into Arabic and get this out to the countries on the mission field. Wouldn't that be awesome? And the other thing she's currently working on, or currently just finished, hot off the press, Owl Pal Divorce. So any of you therapists that are working with divorce, again, this is great for the children, but what about the adults? And I know what I believe that she's getting this information from, like these games, so-called, for children. I don't think they're games for adults. I think it's about dealing with abuse, and it's just another alternative way that we can get to the chronic pain. And there's so many others. And Robin, she's trained in nutrition in so many areas that she understands it in a way I don't. I'm found somebody to write my chronic pain book with that has rods in her back. And she understands it from, you know, one of those standpoints of just horrific pain and living with it every day. So I got to experience that for a purpose. It to me was a pleasure. And it wasn't at the time, by the way. It was on I almost lost my mind through this process, but now I know I can help because now I get it. And these things happen to us for reasons. So whatever you believe, just understand these things happen for a reason. Remember, if I can do it, you can do it. Live your magnificent life and unmasking therapy. This is all very real stuff. I have 4 assistants now. Robin and I are going to be traveling the country. We're going to figure out our calendars tomorrow. And Steph and I are going some places together. And Joe and I are going some places together. And she is the one helping me to make the difference in the logistical ways I don't know. And reality is that we are all inspirations. I'm an inspiration, but I want you to be an inspiration because you are just as much one as me. It's all it takes is one decision away from being that inspiration. And be that, and please be that inspiration for others. I did it as a single mom, you know, raising 3 kids, taking care of my mom while she was dying, going to school, getting my bachelor's, getting my master's, and now I'm coaching and a clinician, and I'm building a group practice and a nonprofit, and I'm just doing it with a leap of faith. So think about that. If you take a leap of faith, you are an inspiration, because people see that and they think, well, if you did it, I can do it. And next thing you know, the whole world is like, you know, taking those chances. Anyway, have a wonderful day. I do feel pain in my body right now. I'm able to hide that. But if you are in tune with me, you would see I get a little tenser. And that's because my muscle responds to the pain. So that means it's time to assess my self-care and what I need to do. So if I can treat it without narcotics, without, you know, a lot of stuff, why not? Anyway, hi, Scylla. Scylla and I have a love for Joe, and I'm going to tag her on this. Anyway, have a great day. Be blessed. Bye.